asking questions, learning, trying to learn more.
Yeah, that's a really good point that you make. I actually got this piece of advice from a client recently, a new client, and they had been with the same advisor in the same company for over a decade. And I was introduced to them, and he took the meeting, the CEO took the meeting, and he said to me when we started the meeting, and I thought this was really relevant to this conversation. He said, "Look, I've got a really good relationship with my broker. We've got a good relationship with our carrier, but I really want to understand what I'm saying no to.
Yeah.
I want to make sure that I'm making a prudent decision, and I'm a good steward of my resources as my company's resources. And for me to know that I'm a good steward, I need to understand what I'm saying no to." And so that's why I always think it's important for, as executives, oftentimes we have our own preconceived notions. We, it works the way that it works, and it's easier just to renew. But the opportunity that's out there for companies to solve this problem is so great. Especially over the last 5 to 7 years, the market has really changed. And if you're not seeing alternatives and you're not seeing different strategies, the biggest piece of advice I can give, in addition to just getting involved, is to seek somebody out that's going to give you a different perspective. It's like a debate. It's you should stay in this type of plan. Well, get somebody in here that's going to have a counter argument and listen to the process, the strategy, the thought behind it, the argument,
Right.
and see what makes sense. And challenge our preconceived notion of the way that it works.
That sounds like the first point in a Let's Get Practical for this episode, right? Okay. So, what advice would you have for our listener, for a founder, CEO, owner who wants to maybe dip a toe in this water? And it sounds like that is understand what it is that you're saying no to.
Yeah. So the number one thing I would say is you need to bring somebody in, find an advisor that has an expertise in doing the type of plans that I just described. Because it's just like I mentioned earlier, you don't want a primary care physician doing brain surgery. So you need to make sure you're talking to the right person that really has an expertise in this. Oftentimes what I hear from clients when they become clients of mine is, my broker kept telling me that this wasn't an option for me. We would ask about a captive or partially self-insuring or what other options are out there, and they constantly told us, there's not really anything that you can do. We talked to another broker and they kind of told us the same thing. So we figured it wasn't really an option, but their CPA brings me in and I'm able to uncover, going through that strategic review that we talked about. These are missed opportunities. This is what the vision and the strategy needs to be over the next 3 to 5 years. Here's the economic opportunity. Is the juice worth the squeeze? And a CEO and CFO looks at each other and says, yeah, we should definitely do that. Worst case scenario is we just go back to doing what we did before if it doesn't work.
Right.
Back. And so if you're not hearing somebody that's challenging that, you need to talk to an advisor, get a recommendation from your banker, your CPA, your business consultant, somebody that can connect you. I've got a network of advisors that I work with nationally. You may have somebody that's in New York or Oregon. I can connect you with folks that have the same mindset and philosophy, doing the same type of work that we're doing. You need an expert to solve the problem using the strategies that we're talking about.
Yeah, I think that makes right. So that's a good Let's Get Practical. If you keep using the same tools, you're going to get the same outcomes, right? Keep doing the same things, you're going to get the same outcomes. So if you want to actually dip a toe in this, see what would it look like, you're going to have to find somebody. You're going to have to do it differently.
Yeah, isn't that Einstein's definition of insanity?
Yeah, that's right. Doing the same thing over and over.
Expecting a different result.
Different results. So try something different. So it sounds like somebody can reach out to you to, okay, so maybe I am in a different state. Who might you know locally that you could refer to me if I wanted to learn a little bit more about my.
Yeah, and I know it's dependent upon the company and their goals and culturally. I mean, I have clients all over the country. I've got clients in California and New York and Florida and everywhere in between. A lot of the business that I do is in Texas. Yep. But I've had people reach out to me and say, I really want to work with somebody that's in my home state, preferably in my town. Can you help me out with that? I'd love to do that. I mean, it goes back to my 1 million life goal of affecting 1 million lives, and I can't do it by myself. And so, I'll just kind of throw this out there. I've got a checklist on my website. So if an executive wants to figure out, oftentimes we may not know the questions that we need to ask of a broker or an advisor to really get to the root of what is this person an expert at. And so in that checklist, I'll give it away. These are questions that you should be asking advisors based on the problem that you're trying to solve, along with answers and responses you should be looking for from an advisor. It'll help you separate the wheat from the chaff. Just like any industry, there are people that have expertise and subspecialties in a market. Health insurance is a big market. You've got Medicare, individual, small group, large group, corporate. Right. And then you have people that focus on fully insuring, and there's people that are experts in self-insurance. How do you separate what type of advisor am I talking to? Is this person really an expert at solving my particular problem? This checklist will walk you through how to ask those questions and what types of responses you should be looking for. So it's going to help you save you a ton of time when you're going through that interview process with a potential advisor.
Very valuable. All right, well, we'll give that website away when we wrap up. I've got a couple of Let's Get Practicals to add, and then I'll circle back to you and say, what do we miss? Early on in the conversation, you said, don't wait so long that your decisions are tactical and not strategic, right? So it is getting involved early, but just the way you framed that is right. So in this whole process, don't wait so long that your decisions you have no choice, but you have to be tactical and not strategic in your thought process, because everywhere else in your business, you're trying to be strategic. So, and then I thought this was just a good awareness, a good tip for a listener that price does not always mean quality, and that there's data behind that. Because I do think that's a belief that a lot of people have about about attorneys and about doctors and consumer goods, right? The higher price must mean higher quality. So I think that's good to challenge that. Chris, what else would you add to a Let's Get Practical, or have we covered everything?
I think what you mentioned, I think that summarizes it really well. Get involved early. I've mentioned it before, but challenge the assumptions, challenge what your advisors have told you. We talked in the first episode about a lot of the misaligned incentives and conflicts of interest. They exist in every component of a health plan, including oftentimes with our brokers.
Right. Excellent. Okay, so now let's get back to the checklists. We gave this at the end of the first one, but let's give it here in case somebody hasn't checked you out in the last episode. What is the best way? Where do I find that checklist? And if I want to call you, or if I want to contact you, is there an email address or a phone number that I should, or should I contact you through the website?
Yeah, so I've got a contact in the website. The website's fixedhealthinsurance.com. And I've got two pieces of information that I give away to employers. The first is going to be the Insider Playbook. So as an insider to the industry, I'm walking through the strategy and the thought process you should be using to design a high performance plan that helps your company and your employees. And that second piece is the checklist we discussed. It's a good handy resource if you're going through the process of trying to hire an advisor, how to compare and contrast, questions you should ask, and responses you should look for.
I think that's really valuable, because you can give me the questions to ask, but I won't know what the answers are. I don't know if they're good answers or not. So that's really valuable. Listener, I would encourage you to go check that out. Make sure that you are, again, if you haven't listened to episode 1 for the greater context of how we got here, there was a lot of great meat, a lot of great value in that episode as well. Chris Hamilton, thank you for joining us, not for 1, but for 2 episodes of this podcast. It's been, I've learned a lot, and I know that our listeners will as well. Thank you.
Well, thanks for having me. The pleasure is mine.
Of course. And listener, you can make sure that you are, if you're listening to us in the podcast libraries, did you know that we have a YouTube channel? So if you go out to YouTube and do a search for the Frustrated CEO Podcast, you can find us there. And if you're watching us, then make sure when you're driving that you're listening and not necessarily watching on YouTube. We don't want you needing to use your insurance. So thank you, Chris, for joining us. Big shout out to my colleagues who are not here today, but who I know will be back for future episodes. Listener, thank you for sticking with us to the end of another episode of the Frustrated CEO Podcast. We'll see you next time.